To confirm that the patient has hypertension, and also to confirm to what level this hypertension has affected the patient, there are various tests that you can do. You understand? So we're trying to look at some of these tests, how we can apply them to diagnosing hypertension and following up with the treatment. So you are aiming at trying to diagnose it, identify what caused it, and access to what level that hypertension has actually damaged the various organs that are usually affected by it. So basic investigation is blood pressure. So you do a lot of readings. You can do the reading as the patient came to the office. You can also, the patient should be doing the readings at home, like that, you know. So urinalysis, you do a urine test so that you see if the patient is able to, what do you call it? To see if the patient is urinating with proteins in the urine or blood in the urine. Also, blood tests like serum creatinine and estimated glomerular filtration rate. Also, electrolyte tests where you measure for sodium, potassium, and calcium. Also, fasting glucose and hemoglobin A1C. Also, lipid profile. Okay, these are the various tests you do. Then, for target organ damage, you can do electrocardiography to see if there's any damage in the heart. You can do echocardiography too, specifically to see if there's left ventricular hypertrophy. Fundoscopy is for the eye, so you're trying to see if there's any damage in the blood vessels of the eye. Then also the urine albumin to creatinine ratio, okay, we are trying to look out for the kidney damage. Then for test for secondary hypertension is you do all those renal ultrasound and Doppler. You are evaluating the size of the kidney, the structure, and the blood flow. Then plasma renin activity and also aldosterone levels. Okay. Then 24-hour urinary catecholamines or plasma metanephrines. Then thyroid function test to rule out thyroid disease, and also sleep study to see if sleep apnea is suspected. So all around, these are the various things you do for blood pressure that will help you diagnose the disease, know the cause, and also follow up when you're treating the patient.